Gout is a type of inflammatory arthritis that is caused by a high level of uric acid that forms a needle-like crystals in a joint and causes sudden and severe forms of painful, tender, and reddish swelling. Some of the risk factors for gout include obesity and diabetes, high blood pressure, and diuretics, which is a class of drug that is used for lowering high blood pressure. Genetics can play a role too. A high level of a substance called purines can lead to gout, and foods that have a lot of purines in them should be avoided or limited in consumption. Examples are organ and red meats, anchovies, mackerel and spinach, beer and wine, and sugary drinks are also included. Treating gout includes treating gout when it happens and preventing gout. Gout can be prevented by lowering serum urate level in the body, and that can lead to gout. Some of the more common places where gout can occur are the foot area and the knee. Pictured are examples of what gout looks like in those areas. Treating gout includes a couple different types of drugs. There are the anti-inflammatory drugs that include non-steroidal anti-inflammatory drugs, colchicine, and corticosteroids. These can be used alone or in combination. If you cannot take these anti-inflammatory agents, then you can try interleukin-1 inhibitors. Popular NSAIDs include indomethacin and ibuprofen, but any NSAIDs are fine to use to treat gout. Colchicine can be taken 2 tabs at one time, then another 1 tablet in an hour later, or 1 tablet 3 times a day for 1 day, the first day. Then, on the second day and thereafter, you can take 1 tablet 1 time or 2 times daily. Colchicine can also be taken prophylactically or to prevent gout. If you take 1 tablet 1 time or 2 times a day. For corticosteroids, you can take prednisone as a tablet or prednisolone as a liquid. Joints that are swollen can be treated with triamcinolone or methylprednisolone by injecting the drug in between the joints. Depending on the size of the joint, you can inject 10 mg for a small joint or up to 40 mg for a large joint. Triamcinolone can be injected intramuscularly once and repeated in about 48 hours. If you have two or more gout attacks per year, you can take preventative measures by using xanthine oxidase inhibitors that lower urate level in the body. Lowering urate level can reduce the chance of gout happening. These drugs include allopurinol or febuxostat. An alternative drug is probenecid. If gout is persistent and will not go away, combining one of the xanthine oxidase inhibitor with probenecid, losartan, or fenofiprate can be tried. If this combination does not work either, pegloticase is a third-line option that can be given by IV every 2 weeks.